So football injuries, they do happen. Sometimes the injured player will need to sit out with a bag of ice. Sometimes they can reasonably and safely continue playing. And sometimes the injury, unfortunately, can be serious enough to require medical attention. So today, we are joined by Dr. Manuel Schubert. He is an orthopedic and sports medicine physician at the Detroit Medical Center, our great partners. And he's here to talk about common football injuries, also treatment and prevention. He's a former Division I wrestling athlete. While completing his sports medicine fellowship at Stanford University, he served as one of the team physicians for the Stanford football team, as well as assisting with the care of the San Francisco 49ers. So you should listen to what this man has to say, because he knows what he's talking about and he's dealt with it at every level. So welcome to the Extra Point Podcast, Dr. Schubert.
Thank you, Lorne, for having me. Really appreciate it.
All right, great. So it's great that you are here, and let's get into it. Knee injuries are one of the most common football injuries we see. In general, how serious are ACL injuries and how are they treated?
So great question, Lauren. So ACL injuries are serious injuries. They lead to the knee being unstable with certain movements. So they lead to the knee being more unstable with various cutting, pivoting, twisting, jumping movements, allows the knee to move more forward, or the tibia, which is the shin bone, moves more forward than it should, and also leads to some rotational instability of the knee. That also is often accompanied with meniscus injuries, which are the shock absorbers of the knee, also cartilage injuries, and these can also be associated with other ligament injuries as well. And they occur most commonly with non-contact twisting injuries. So oftentimes it's not even with somebody getting hit, but it's as they're running down the field and they make a cutting or pivoting motion, and then that's when they happen. Oftentimes players feel a pop and have immediate swelling in the knee, and so those are some things to keep an eye out for when we're concerned about an ACL injury. Now, although not all ACL tears require surgery, especially partial tears, which are considered sprains, most often, if it's a complete ACL tear and the knee is unstable, we do recommend surgical intervention. And the surgical treatment for that consists of an ACL reconstruction. Now, some physicians are doing ACL repairs on select groups of patients, although we're really learning more about that process as well. And so, although that is a selected alternative for various patients, more data is really needed on that. So really the gold standard of treating complete ACL tears is an ACL reconstruction. And typically for young athletes, we recommend using your own tissue for that reconstruction. So we would take one of your own tendons to recreate that ligament. And what we do is when an athlete does have an ACL injury, we make sure that their knee range of motion improves, they're walking more normal, and their swelling goes down before we actually do the surgery to get them in the best shape before actually undergoing the procedure. And then following surgery, we do post-operative physical therapy for many months after, and typically recovery from an ACL reconstruction is anywhere from 9 months to a year before returning to full play. Some athletes are able to return a little sooner, some later, but that's kind of typically what we're looking for, especially in the younger athletes that we're dealing with.
And athletes in today's modern day should feel grateful the fact that they've made great strides in the treatment of ACL injuries and the surgeries and your recovery time. It is not a game ender. It may be a game changer for a while, but it is not a game ender. You can get back and play and be who you once were. Now, the big topic of concussions has been on the national scene, especially what we saw with Tua Tagovailoa for the Miami Dolphins and that kind of scary incident that happened when he had a head injury in the NFL. And obviously, when you play football, you are susceptible to possibly receiving a concussion. So the topic about when to come back after a concussion is always on the minds of those who are affected by it. How should a concussion be treated?
Yeah, it's an excellent question. So as you alluded to, concussion management is a big topic. It's been, a huge issue of conversation, especially over the last couple of years. How can we better diagnose these, effectively treat them, and minimize them? And so, injury prevention Ultimately, really the first step to treatment is actually identifying a concussion and being able to properly diagnose these in athletes so that we can get them off the field and get them on the road to recovery. And things to keep an eye out for symptoms of a concussion are including headache, and that's usually the most common symptom that we see in athletes. Other things can be dizziness, blurry vision, balance problems, nausea or vomiting, sensitivity to light or sound. And so these are all very common things. Other things that people describe are feeling like they're in a fog or in a cloud. They just feel slowed down, difficulty concentrating or remembering things. So if an athlete has any of these, you really want to have a high alert or suspicion for a concussion. And what we say to family members, coaches, when in doubt, sit them out. We don't want to keep these players in. And if there's concern for a concussion, we really need to take them off the field right away, not let them get back in the game the same day. Really need to have a thorough evaluation to see if they really do have a concussion. And if they do, we need to follow the appropriate steps to get them back in a safe and timely manner. Typically in the past, we used to think that to manage concussions, they need to be in complete isolation, stay in a dark room, completely isolate themselves from any stimuli. But we know more recently that that's not the case. We really want players to only have relative rest for the first 24, 48 hours. But what relative rest means is that they kind of minimize a lot of stimulation in terms of screen time, reducing that, less TV, less phones, less video games, things like that, up to the point where, it's not causing any worsening of their symptoms. But once they start feeling a little better, they can kind of gradually ease their way back into those things. Other things to avoid initially are anything that requires high mental concentration or a lot of focus, such as reading, texting, or like I said, using a computer, or schoolwork, but really easing into it after a day or two. So really just kind of letting the brain rest for the initial 24 to 48 hours, and then easing back into those things. In addition, we kind of let them rest from any kind of physical activity for the first day or two, and then also ease them back in a stepwise manner. We really want to make sure that they can start doing some aerobic exercises early on after that first day or two, without inducing any more symptoms. And once they are able to do those lighter activities, we get them back to more sport-specific exercise in a controlled manner without any contact. And by doing that, we make sure they can do all those things without any recurrence of symptoms. And if they have any symptoms when they do those activities, then we have to take a little more time, let them recover more, and then try those activities again before we let them move on to the next step. And ultimately, as they're feeling better without any recurrence of symptoms, we can get them back to full practice, initially without contact, then with contact, and then full return to play. And that time frame can be anywhere as early as 6 to 7 days, or it might take longer. Concussions are different for every athlete, and we really have to tailor it to each athlete individually.
Guys, there's a reason why the DMC is where the pros go. So you need to go where the pros go. This is great information being provided to you, and we're talking about the most common football injuries and questions that you may have. And Dr. Manuel Schubert is here giving us some really great information. And of course, if you need any type of treatment or anything of that nature, I'm going to let you know at the end of this conversation where you can go and make sure that you are being taken care of by the DMC. So we mentioned surgery a little bit earlier when we had our discussion. One of the things I know that parents get the most concerned about is when an athlete is injured, especially on the football field, is it going to require surgery? Surgery is not always the first or only treatment choice. So maybe you can just quickly, give us some non-surgical treatments that the DMC offers to treat sports injuries in general, let's say.
Yeah, and I would say, most injuries that we come across don't require surgery, so we have a lot of tools at our disposal at our various clinics, and even, on the sidelines when we're helping to cover games. And so, various things that we can do for patients and athletes are getting them into various braces, splints, casts, slings, different kinds of boots that they might need for ankle injuries. And so we have a lot of those at our clinics, and help players get back to where they need to be without any surgery. In our clinics also, we can provide various home exercises to patients in order to allow them to do various stretches and exercises at home in order to get back to where they want to be on the playing field. We can get players back into physical therapy as that's often a common thing that we do to allow patients to recover in a non-surgical manner. Sometimes we might recommend various medications such as anti-inflammatories to reduce inflammation and including reducing pain and swelling, and that can oftentimes help with various injuries. Other things, sometimes various injections can be a treatment that can help certain injuries, whether that's a steroid medication or various biologic treatments such as platelet-rich plasma to stimulate a healing response. And these different injections can be better for certain injuries and not others. And so that's something we can talk to players and parents about. And then also some of our physicians at the DMC also do manipulative therapy, and it's kind of a mechanical massage type therapy to release trigger points and treat mechanical pain. And that's something that a lot of our therapists do as well. And so those are a lot of the non-surgical treatments we offer at the DMC.
Yeah, it's amazing. There are so many new breakthroughs that have been made. PRP is one of them that he just kind of talked about. And so there's lots of options that you have in order to treat your injury, get you back on the field. But if it's a situation where an athlete needs surgery, what resources does the DMC provide to support athletes during their recovery?
So we have a lot of close follow-up with our patients. We offer clinics throughout all of Metro Detroit and are expanding as well. And so there are a lot of different avenues that we can get patients in and out quickly through our different locations. Also, we have a tight-knit group of physicians, and so we can bounce ideas off our colleagues, and also we have close communication with our therapists. And so that's a way that we can effectively communicate about athletes' progress and in terms of improving their recovery following surgery. Also, we effectively communicate with coaches and athletic trainers so that everybody's on the same page in terms of what's going on with the athlete, where they're going, and how quickly we can get them back to the playing field. As I talked about briefly before, we have a great network of physical therapy locations throughout Metro Detroit as well, and they offer various services in addition to just kind of basic strengthening and stretching. They have various recovery compression boots. They deal with blood flow restriction therapy, soft tissue mobilization techniques, and so there are a lot of different things that can be done after surgery to help athletes recover. And then once athletes get far enough out from surgery, we have a lot of return to sport testing that our therapists can do at the different locations, including a very novel wearable sensor technology called Dorsa V, and that allows players to get very objective data to see where they're at with their recovery. And then down the road, once they're out of the recovery phase, we also do various sports performance programs in order to optimize players' mechanics and strength throughout the year as well.
Okay, final question. When should someone see a sports medicine or orthopedic physician?
So if anybody has a sports-related injury, whether it's a new injury, a chronic injury, or they just want to optimize their athletic abilities and fitness level overall in a safe and effective manner, those are all times when someone might want to see an orthopedic surgeon or sports medicine physician. So with new injuries, we can effectively diagnose and treat those injuries. Same thing with chronic injuries, and also with chronic injuries, figure out why those injuries are going on, identify various training errors that might be going on, biomechanical abnormalities that might be resulting in these chronic injuries. Or if somebody's interested in injury prevention or sports performance, those are all reasons to come see one of us, and we can help you out with all those areas to help players get back to playing to the level that they would like to.
Hey, if you're an athlete, there's no reason why you should not be seeing a sports medicine physician. They've got the tools and they've got the understanding, the knowledge, and all the options to offer you to get you and have you be as healthy as possible as an athlete. Well, the DMC is the official healthcare provider for the Detroit Red Wings. So if you have a sports injury, go where the pros go. The orthopedic and sports medicine team at the Detroit Medical Center. To learn more, visit dmc.org/sports or call 1-888-300-DOCS. And we thank Dr. Manuel Schubert for joining us on Extra Point. Thank you, sir.
Thank you, Lauren. Really appreciate it.
All right.